Hello and welcome. Today we're diving into a rare and often overlooked urinary system condition, Guaifenesin stones. While not a common occurrence, understanding this phenomenon can be crucial for certain individuals. Join us as we explore the causes, symptoms, diagnosis, treatment, and prevention of Guaifenesin stones. So, how do Guaifenesin stones form? The primary culprit is, unsurprisingly, Guaifenesin, an expectorant commonly found in over-the-counter cough medications. When taken in extremely high doses, especially with inadequate fluid intake, the kidneys may struggle to process and eliminate the guaifenesin. Over time, this excess guaifenesin can crystallize and form stones within the urinary tract. It's important to note that therapeutic doses rarely cause this issue. The pathophysiology of guaifenesin stone formation is relatively straightforward. After ingestion, guaifenesin is metabolized in the liver and its metabolites are excreted by the kidneys. When an individual consumes a substantial excess of guaifenesin, the renal tubules become overwhelmed. This leads to supersaturation of guaifenesin metabolites in the urine. Under the right conditions, these metabolites will precipitate out of the solution, forming tiny crystals. Over time, these crystals aggregate, eventually forming larger stones that can obstruct the urinary tract. Guaifenesin stones are considered a rare phenomenon. Accurate epidemiological data is limited due to the infrequent occurrence and the potential for misdiagnosis. They are typically associated with intentional or unintentional overdoses of guaifenesin-containing medications. Individuals with pre-existing kidney problems or those who are chronically dehydrated may be at a higher risk, although further research is needed to confirm this. The signs and symptoms of Guaifenesin stones are similar to those of other types of kidney stones. These can include severe flank pain, often radiating to the groin, hematuria or blood in the urine, nausea and vomiting, dysuria or painful urination, and frequent urination. If an infection develops as a result of the stone obstruction, fever and chills may also be present. Diagnosing Guaifenesin stones can be challenging, as they are not typically included in routine kidney stone analysis. A detailed medical history, including medication usage, is critical. Imaging techniques, such as a CT scan or ultrasound, can help visualize the stones within the urinary tract. Chemical analysis of the stone itself, obtained through surgical removal or spontaneous passage, can definitively identify the presence of guaifenesin metabolites. Classifying guaifenesin stones is mainly based on their location within the urinary tract and their size. They can be located in the kidneys, ureters, or bladder. The size of the stone will influence the treatment approach. There are no specific subtypes of Guaifenesin stones beyond these factors. The primary treatment for Guaifenesin stones focuses on pain management and facilitating stone passage. This often involves pain medication and increased fluid intake. In cases where the stone is large or causing significant obstruction, more invasive procedures such as lithotripsy, using sound waves to break up the stone, or surgical removal may be necessary. Reducing or eliminating guaifenesin consumption is also crucial. Prevention of Guaifenesin stones revolves around responsible medication use. Adhering to the recommended dosage of guaifenesin-containing medications is paramount. Maintaining adequate hydration by drinking plenty of water throughout the day is also essential. Individuals with a history of kidney stones or pre-existing kidney conditions should consult with their healthcare provider before using guaifenesin products. The prognosis for individuals with Guaifenesin stones is generally good, provided the condition is diagnosed promptly and managed appropriately. Recent research in this area is limited due to the rarity of the condition. Future studies could focus on identifying individuals at higher risk and developing more specific diagnostic and treatment protocols. Continued awareness among healthcare professionals is key to ensuring timely and effective management of this unique urinary system disorder.